This is Zafar Awan Abundance Wala, and you're watching Abundance Show. And my channel is Global Abundance Organization channel, GAO TV. And today we are honored to welcome Mr. Adnan Siddiqui, an accomplished global leader and visionary entrepreneur. He currently serves as Chief Operating Officer at Easy Shifa, a pioneering organization revolutionizing primary health care and accessibility across Pakistan, UAE, and Nigeria through technology driven solutions. With over 3 decades of diverse leadership experience in healthcare, technology, and non-profit sector, Mr. Siddiqui is also the founder of the Startup Council, empowering entrepreneurs with resources and mentorship. He holds dual master degree in mechanical engineering and business administration from Oklahoma State University, USA. His passion for social impact is evident through his dedicated service at RAST Foundation, focused on eradicating illiteracy in developing nations. We are truly privileged to have him with us to share his journey of creating abundance through innovation, technology, and community empowerment. Sir, Assalamu alaikum and welcome aboard.
Well, thank you very much and glad to be here. It's a privilege and honor to be with you. Thank you.
सर अदनान सिद्दीकी सबसे पहले हमें अपने इब्तदाई सफ़र और तालीम के बारे में बताइए और वो अवामिल ख़ास तौर पर जिन्होंने आपको कामयाबी के इस जीने तक पहुंचाया.
So I think it's a very pretty straightforward journey. I born and raised in Karachi. I went to NED, graduated from NED about 100 years ago, and almost the same year I left for States. When I was in the States, I did my master's and MBA, started my PhD, and I worked for I worked for a company called Whirlpool for a while, and then I left Whirlpool and joined Compaq in those days. That translated or merged with Hewlett Packard HP. So I was with that combo for about 20 years. I left HP and joined Amazon Robotics. And in 2018-19, I decided enough of the corporate world, so I retired. So here we are. I started working with the startups. I'm an angel investor, and I help the startups do their thing. And in those days, that's when I stumbled over that Pakistan, mein 150 million people don't have access to healthcare, and about 100 million people each year file for bankruptcy. Since in Pakistan we don't have a concept of bankruptcy, people have to sell their houses, their cars, their businesses, the wife's jewelry, take loans to pay medical bills. And so because of that, I thought that being a technologist, I thought that technology can solve this problem. And so I decided to move to Pakistan in 22, and for the last 3 years I've been at it.
Okay, sir. I mean, as you said, this is very true that we do not have any mechanism here in Pakistan that helps signing us bankruptcy and getting us any problem we are out. But I mean, how would you help the country like Pakistan where there is no such system? What's your idea, sir?
So I think one of the major problems that we are facing right now is, right, 100 million people each year are filing for bankruptcy. When I say filing for bankruptcy, what I mean is somebody's selling their house, somebody's selling their car, so they're selling their jewelry to pay medical bills. Recently, I was in one of those Uber or Kareem in drives, and I went to one of the hospitals, and the taxi driver asked me if I work for the hospital, and I said no. I just came here to have a meeting with them. And he said a couple of months ago, one of my relatives died in this hospital, and they would not release the body until I submitted the papers of this car, and they're holding those papers hostage for the last 3 months, and I'm having a difficult time making a living, not having the papers with me. So I think this was just a random example, and there are thousands of examples of that. Now, uh, how do we protect people from this? Everybody is likely to get sick. People are getting old. Everybody has an elderly person in the family, mother, father, grandfather, grandmother. They're getting old. Now they're likely to go to the hospital. And when they do, their whole savings, life savings, is drained, right? So there are two ways to do that. One is we drive the cost out of healthcare. So when you go to the hospital, it should not cost you millions of rupees to pay the bills. That's one. The second part is we bring these people under the umbrella of insurances. I think so. As an Easy Shifa, we are working on both tangents of this. We are working diligently to drive the cost out of healthcare. That's our basic focal mission. But in parallel, what we are doing is we are increasing the base of healthcare. Today, medical insurance is about 3 to 5% in Pakistan, right? If you take the Sehat card out of this picture, which we can discuss that later, but an average corporate insurance is about 3 to 5%. So that means there is an opportunity of 97% of people, those who are not insured, should be brought under insurance. So Easy Shifa as a product, what we're doing is we set the goal in next 10 years, we're going to grow this market from 3% to 25%. That's a huge leap. It's never been done in the world at that such a rapid pace. But with the help of technology, I'm very confident we can do that. And the way we are approaching this, we are going to corporations and we are showing them, we are doing the medical screening of all their employees. As soon as we do the screening for all the employees, we are identifying about 20 to 25% of people, those who have some medical condition, diabetic condition, they have some heart disease, hypertension, this, that, or the other. Once we identify them, we are proactively managing them. Hey, Zafar Saab, you came yesterday and your blood pressure was high. Would you please come back again and let's measure it again? So once we measure it 3, 4 times, and if it's still high, we connect you with the doctor. We put you on some medication. We advise you to change your lifestyle and all. And then we manage this. We have shown in the last 6 months or a year, by doing so, we are able to reduce the hospital visits, hospitalizations, and ER by 20 to 30%. That's a straight savings for the insurance company that goes into the bottom line of the insurance company. They are very happy. In parallel, the Seth Saab, who is running the company, he's very happy because 30% of his employees, those who are supposed to go to ER, they don't go there. So now the absenteeism is less. The third asset is what we are telling the owners of the company. Okay, next year, when the insurance company comes in for renewal, you should ask for a lower rate because they have saved 30% that they were not planning on. You should get the benefit of that. So they will get to reduce the cost. As soon as they reduce the cost, the state is likely to increase the span of insurance to other employees. With the same information, I'm going to other insurance companies and telling them, hey, such and such insurance company worked with me and they were able to save 30%. Next year, when you go compete with them for renewal, you will not be able to compete with them because they are 30% less than you are. So you better come with us and use the same program to get the cost savings. So this is having a ripple effect. And I think we are heading in that direction. We are almost there. So almost all the insurance companies in Pakistan, we are in touch with them. We are expanding it. So this is growing like crazy. This is very, very good. Good for the insurance companies, good for the corporations, and the best of all, it's good for the employees. And it's getting closer to our vision, expanding the health coverage base to larger and larger population.
That is a success story, and I would say this is the first step towards healthy Pakistan and healthy corporations. And sir, what's the technology that you're using? Is it like data-driven abundance, I would say, rather, or I mean, what is the real technology that you are using, and do you want to tell it to the people to follow your footsteps?
Right. So actually, when it comes to technology, I worked for Hewlett Packard for 20 years, and we are always working on the cutting edge and the bleeding edge of the technology, right? Uh, to solve majority of the global problems, you don't need bleeding edge technology. I believe that we should take n minus 3, n minus 4, n minus 5 technology, which is mature, stable, low cost, and take those, integrate that into the system, and provide a service that's more affordable. I'm hearing these conversation in Pakistan. Okay, we went and bought a system which is 25 crore का system है. We brought it in and then we are applying it. उसकी maintenance की cost जो है $50,000 per day and all that stuff. And that serves 0.0001% of the people, right? Somebody was telling me, okay, we want to have an air ambulance. And I'm going, air ambulance, 30-40 million dollar project, maintenance cost about $1 million a month, and you will service maybe 2 people, 5 people, 10 people per year. With that sort of money, you can service 25% of the population in primary care, right? So we always go for technology that is stable, mature, affordable, and have the expertise available that can be integrated. Now what you have to be creative where, how do I integrate what technology where, and how do I make it accessible and affordable to everybody? And that's the genius, and which is really not a genius. It's just you have to stop, think for 15 seconds, and you will have it. There is no rocket science in it. It's very simple.
It's simple to you, but I mean, how about the people like other? If it was that simple, I mean, why would it not be here in place? And I mean, we are. I mean, you see the health issues are already there. So how would you like to? Would you like to suggest it to the nation too?
Yeah, as a nation, I'm sorry, I'm not pounding on Pakistan or Muslims for that matter. Uh, we lack creativity. We when we talk about doing something, we always talk about, Acha, this is how I'm going to make $5, or this is how I'm going to build a factory and I'll make money, or I'm doing this philanthropic organizations. I'm making a clinic and I'm going to provide free healthcare to people in my community or whatever, 50 people a day. We don't talk in terms of let's solve a problem. We have a healthcare problem, and I don't see anybody saying, let me do this and I will solve this whole problem. अच्छा मैं स्कूल खोल देता हूँ 100 बच्चों को पढ़ा दूंगा मैं एक हॉस्पिटल खोल देता हूँ क्लिनिक खोल देता हूँ and then I will service 50 people a day. Nobody talks about this. There is a need of 2 million appointments per day in Pakistan. Let's come up with a system that's going to service 2 million appointments a day. I mean, I will challenge these huge, humongous corporations that we're talking about. Uh, just to name a few, Indus Hospital, Al Khidmat, they're doing a phenomenal job. They're doing a very, very good job. Can they scale to 2 million appointments a day? The answer is no. They cannot. So we have to start thinking in those lines. How am I going to solve the problem? Are we solving the problem? So there are 3, 4, 5 major problems in the country, right? One is the healthcare is a major issue. Let's start thinking at a national level how we are going to solve the problem. And we, the people, have the capacity to solve these problems. We have it. We can do it. Technology is on our back. With the help of technology, we can do it. The next is education. Third is entrepreneurship. The fourth is the technology transfer, and then the fourth one is entrepreneurship. These are the 4 pillars. If we just stand on these, take one at a time, we can transform the whole country in the next 25 years.
Thank you, sir. Sir, how does Easy Shifa plan to make universal healthcare a reality, especially in under served areas?
Right, right. Very good question, and I think that this is very at the end. People often ask me, "Okay, how long are you planning on staying in Pakistan?" And I told them by 2030 something, we will launch universal healthcare. That's when I'll go back to Seattle and start my retirement. 2030. The way it's going to work out, we have 25 digital clinics in area. In the middle of those 25, there's going to be an ER, emergency room. So people we cannot service. So somebody walks into my digital clinic and say, I'm having a heart attack. We cannot do much about that. Instead of giving them a pill and ask them to just lay down and send them to the ER, we send them to ER, and then this cluster of digital clinics in the ER, 25 of these should have a full service hospital. We the total clinics that we need is 50,000 corresponding ERs and the corresponding hospitals. We think we will be able to get to that point in 2035, 36, something like that. And by that time, we will be in a very good position to offer universal healthcare. In order to get there, you have to drive the cost out of healthcare. With the current cost structure, we will not be able to support and sustain it. So that's our plan. And I think we are in motion already. As of today, I'm proud to say we have about 350 digital clinics. We are planning on being 1,000 by the end of this year. Inshallah, we will be reaching 50,000 of those clinics by 2030 something. One thing I want to emphasize here, this is very, very important. 50,000 clinics that we are talking about in Pakistan, these are individually owned. Majority of them should be individually owned. 25,000 of these should be owned by females. If we don't bring females into this segment, we will not be able to solve the problem. Right? So it's very, very important that we bring 25,000 of these clinics must be owned by females. Now, in order to do that, I am fully aware that in Pakistan, say if somebody lives in a village or not in kind of rural areas, and they have 3 kids, 2 girls and a boy, with limited resources, they will send the boy to the school and not the girls. We all know that. This is the fact of life. I'm not making it up. In order for me for 25,000 females to own this clinic, I have to design it for the girls, those who did not go to school. My digital clinic should be so simple that the girl in the village with a couple of days of a week's training should be able to run and operate the clinic. This is our plan. So these are a few things we are going to do to get to universal healthcare.
Right, sir. What were the biggest challenges you faced in deploying digital clinics across different countries?
So let's start with Pakistan. Almost every telemedicine company right now is struggling with traffic. People are not. It's a huge paradigm shift. And the country of 220 million people, bringing a paradigm shift is not easy, especially with limited communication, limited network, limited education. It's difficult. So the way we are approaching it is those who are going to places where there already a doctor and the hospital and the clinic is available. We are deploying our digital clinic there and asking them, hey, if you want to wait in line for 2 hours, you're more than welcome to do that. And then you can see the doctor. But if you don't want to wait 2.5 hours, there's a digital clinic. You will have the similar experience. Just talk to the doctor at half the cost. We are getting an overwhelming response. So don't ask people to go someplace new for digital clinic. Instead, wherever they're going, just reach them at that spot. I think it took us 2.5 years to figure this out. Now that we have established that, I think it's a whole lot easier. And it's getting moving up. दूसरा ये था कि I think the environment in Pakistan, the uncertainties, the lack of law and order is people are afraid to make commitments, and even when because of all this environment that we are in, uh, lack of commitment. I mean, if signing a contract doesn't mean deadly in Pakistan, right? You can sign every day long, and then everybody walks away, walk back from the contracts, which isn't. So I this is one of the things that I lived in the States for 40 years. Supposedly, I mean, not as 100%, but supposedly an honest society. I'm having a cup of coffee with Joe, and whatever Joe is telling me, I believe 90% of that he's going to be telling me the truth. I don't have to worry about it कि यार ये जो कह रहा है वो सही कह रहा है या गलत कह रहा है. In Pakistan, I have learned it the hard way. When people come to me and having a conversation with them, 80% of my energy is consumed कि यार ये झूठ बोल रहा है कि सच बोल रहा है. And that's a difference between an honest society and a dishonest society. And so instead of 80% of my energy in solving the problem, 80% of my energy is going towards deciphering whether he's telling me the truth or not. And I think that's the challenge. I'm not saying by any stretch of imagination that USA is wo khana kaba ko hath la ke aaye mein and they are the honest people, this, that, or the other. But in general, it's an honest society. हमारे यहाँ we say Islam सुबह से लेके शाम तक and उस पे वो काले पर धब्बे पड़े होते हैं उसके ऊपर माथे के ऊपर. But at the end of the day, the act, we actually don't understand it. We say it, but we don't understand the need for it. Honestly, I think that's the biggest challenge we have.
Very, very well said, sir. I mean, actions are more important than what we say. Sir, what role does technology play in reducing the cost of healthcare?
So let me give you a very good example. हमारे पास हमने AI का अपना एक engine बनाया है, one of those. And what we do is we make a 15 seconds video of your face. And from that 15 seconds video, we calculate your blood pressure, your temperature, your heart rate, your oxygen level, and your blood sugar. Now, that said, what happens is, so we are working on it. We will release this in next few months. उसमें क्या है कि somebody who is diabetic, उसको मैनेज करने के लिए 3 से 4 हज़ार रुपए लगते हैं, right? उसको रोजाना सुबह को prick करता है, उसकी शुगर चेक करता है, then it finds out उसको कितनी इंसुलिन लेनी and all that stuff, right? हम ये कह रहे हैं कि हमारी जब ये डिवाइस आ जाएगी, we will charge 100 rupees per month. So something that used to cost you 4,000 rupees is going to cost you 100 rupees now. हमारा जो विजन है कि when you go to the doctor, there are 4 costs involved in it. Travel to the doctor, consultation fees, medication, and the labs. हमारा goal ये है कि all of these 4 costs should be 500 rupees or less. जिसमें आपका travel भी शामिल है, doctor, medication, and the lab. All should be in 500 rupees or less. And this is going to happen. We will place the unit close to your house so you don't have to travel. That's number one. Our doctor costs you 100 to 200 rupees. That's number 2. Our doctor writes generic medication, which is again 100 to 200 rupees ka you will get the medication. We are developing our own biomedical devices using AI engine and indigenous products designed and developed, manufactured in Pakistan. So we're going to bring the cost of the diagnostics down. And with all this, if I can afford to give people 500 rupees complete healthcare, I think it's a game changer. It's a game changer.
This is amazing. Honestly, I mean, as we are facing inflation and everything, I mean, price hike is so people are paying through nose. And I mean, if you're presenting such an idea, this is a game changer. And I don't think so anybody would miss it. Sir, how is HAWWA project transforming pregnancy care for women.
Hava is a pregnancy management system, and the reason for generating Hava was uh, Pakistan is one of the worst countries in the world when it comes to infant mortality, childbirth related complications, and deaths. So, with that in mind, we started thinking how we're going to do that. So, first, we made a pink color Hava unit just for pregnancy management. As soon as we did that, we were asked, hey, pregnancy management without ultrasound is not possible. So we went and brought an ultrasound and we integrated that into the system. The rest of the country is charging 3,000 to 5,000 rupees for the ultrasound. Our ultrasound is anywhere from 2,000 to 3 400. Sorry, to 200 to 500 rupees, depending कहाँ पर है. Then I was asked, hey, उसमें है pregnancy में we got to do the hemoglobin test and iron deficiency test. These are three things that are the most important part in pregnancy. We have already brought in a non-invasive hemoglobin test that you can just put your finger in and you get the hemoglobin. So the thing that used to cost you for 1,000 rupees to get the hemoglobin test or 700 rupees, we can do it now for 50 rupees or less. So just
This is
making healthcare
miraculous.
right, this accessible to females close to their house. They don't have to travel at an affordable cost. Hopefully, we will pull Pakistan out of this being one of the worst countries in the world when it comes to infant mortality and childbirth related complications and deaths. Inshallah.
So, is there any collaboration between you and the government of Pakistan? Any collaboration between you and World Health Organization, between you or other organizations working for the health?
Right. तो हम उस शायर की तरह से हैं जो अपने हाथ में दीवान लेके फिरता है, जो हमसे कहता है हम दीवान लेके खड़े जाते हैं, खोल के अपना मुशायरा शुरू कर देते हैं. Right. So anybody who is willing to talk with us, we are talking with them. The provincial government, the federal government, right? WHO, UNICEF, and you name it, Gates Foundation, everybody and their brother. We are talking to almost everybody. We are in touch with most of them. Most of them are aware of us, and those conversations are in progress. Unfortunately, we have not been able to sign any contracts or deliver any goods yet, but the conversations are very active.
Adnan bhai, do you think is there any role I can play as a podcaster to reaching people like yourself and talking? I mean, taking them aboard. And this is a fantastic. I mean, you are. This is in fact real jihad that you are doing, and you are doing for the cause of humanity, and you are doing it globally. I mean, you are abundant person. This is abundance. In fact, I mean, this is my cause too, and this will help alleviate the poverty. And your machines and everything, we Rihan Foundation can help you a lot because they are all doing the stuff without any primary schooling or anybody can come in and get to learn. And you resonate, your ideas resonate with Sarihan's heart very closely. I mean, you guys, though the field's a bit different, but I mean the idea is same. I mean, you want to serve the humanity. So does he. So, is there anything as a podcaster or even the Rehan Foundation? There are kids, a lot of kids. I am also. I've been given certain interns. They are interning with me, and as you know, I am also holding a summit, Pakistan Abundance Summit next year, 2026.
Inshallah.
So, and the concept is same. Peter Diamandis do there in USA, and he is the most highly focused. He is on healthcare, and the most of the amount spent right now in US is on the research in healthcare longevity, and the highest of it. In anything, I mean, you want that I need your advice on the issue.
So I think Rehan Foundation is doing a phenomenal job. I think you guys are doing very, very good job. I think where we need to collaborate, Joe, the kids, those who are coming up from your schools, we need to work with them to start developing biomedical devices in Pakistan, right? Both actual physical devices, the solutions, the AI engines, all of this we can help we should work with you very closely. I can identify what has to be made. I can get 5 or 6 kids from your institution and guide them how to develop it, how to mature it. Once they make it, Easy Shifa can be your first customer. That's one angle, right? You're sitting on a huge this platform of communication. Blast it out that go towards technology, use technology, and become a solution provider. Don't try to take, don't wait that somebody's going to do it for you. I think we the people are going to solve our own problems. This is 2025. We have the technology, we have the know-how, we know how to scale, we know how to create things. I don't need infrastructures, the government, the politicians, and this, that, or the other to solve healthcare problem. They will guide us, give us the regulations, but the groundwork we have to do, and we can do it as the people. I think your platform is very, very important for me, and that's one of the reasons I'm so excited to talk with you. That amount of work, the amount of outreach you have, how we can collaborate and get to those 150 million people, those who are waiting for us.
Sir, what if I hold a virtual summit in the April in mid May, like 2 to 3 weeks from now, and we talk. I invite doctors, not only from Pakistan but around the globe, and or otherwise entrepreneurs or the investors or any person, and as many as I have the contacts. Let's do it, in a conference, and I think this will give you a bit of boost. I really can't claim anything because I have no experience, no knowledge, no nothing, but I have a belief. I have a belief when people get together, and to perform something positive, like your own mindset. I find people around the globe. Those are positive. They work. They want to work for abundance. They may not have the expertise that you have. They may not have the experience and intellect that you have. But they want to work. Myself. I'm a layman. I do not know ABC of the medicine and what you are doing. Not at all. But what I can do, I can bring the people who can work, people of exponential mindset and growth mindset. So then you people can do, this is what I can do. This is my platform, and I really, yeah, I look forward, and I need your advice. How do we do this? I can connect people and ask to, let's connect and have medical abundance summit, or whatever you want to name it. And I can do for you. I'll start podcasting. I'll start. What my strength is, I am an insane networker. I keep talking to the people, then I keep collaborating them with each other, and that's what I want to do for the cause. Because if at all I do something, and if there is some one person who gets benefit out of this medical care, I think this will be enough for my akhirah. What do you say?
I I love it. I love it. Uh, Burton Russell said, "A good life is lived with passion." And your last 30, 40 seconds speech was just so telling, so telling. I just love the passion. I have been hiring people for last 40 years. I hardly ever read the resume. I hardly ever read the resume. I just talk to them for 5 minutes and see if they have the spark and if they have the passion. I can take any idiot and I can teach them in 6 months and make them a champion. Not a problem. This is all very superficial. I cannot give them the spark. I cannot give them the motivation. That has to come from inside. Pleased and so honored to be in your presence, that you have that drive and the passion. Love it. Love it. Let's just keep talking about this thing. Please connect people and talk to people. Just get the word out the best you know how. And then I'll keep coming back and giving you more technology. This is what we're doing. This is the path. Like today, we talked about the insurance portion of it, right? Next day, we'll talk about the entrepreneurship. Then we will talk about how we are going to take healthcare into education. Every clinic that we have can become an institution for education. I can train 5,000 nurses per year from my digital clinics without spending a dime. So I think there is a lot that we can do. Just keep communication. And again, I am so thrilled with your passion. Thank you very much. Thank you very much. I think the nation can need few more people like you.
I'm sir, I'm honestly honored. I mean, I'm so humbled. Since I have no confusion about myself, am honestly nothing. But I mean, I want to work. I know the. To me, I am just 0%. But I know hero people around me. I have been since I have been brought up in a cadet college, and those all are on very great positions right now. Be any organization and any field they are there. What I can do, I can connect those people. I can ask them to join our summit, and I'll be connecting. I mean, I right now, I mean, I really pledge with my Allah that I'll connect a person, one or two of each week or each day, whatever I can. I'll be doing that. And I really request you to do this podcast thrice a week or at least twice a week, so that I mean more and more people can come in, and I also keep it on my mind, and I also keep joining. I've got I mean 200 doctors in my phone, so I can ask them, request them to come. Maybe 10 or 20 may turn up. That will make the mayor go, I suppose. So I mean, I need your guidance and advice on the issue.
Sure, definitely. Let's keep talking, and let's see how we're gonna. I think this is a great opportunity, and I appreciate this. Thank you.
Thank you, sir. Do I go for the next question? And now I like to ask you about your personal life, and nobody knows. Like, I mean, your hobbies, your leisure time, or like, do you like music or anything that I mean, just because in our the way behind a successful person, there is certain hobby that gets him or her motivated. So what's yours?
So, by trade, actually, when I was growing up, I was a sports person. I had very little to do with education. In my When I was in high school or up to 10th grade, I was the captain of the field hockey team. I was the captain of the volleyball team. I played cricket, basketball, and ping pong. So I had zero time for education. I was very, very busy. But somehow in Karachi, I graduated, and then I ended up in Adamji College, one of the most prestigious colleges in Karachi. Uh, in Adamji College, I played basketball, volleyball, field hockey for college. And of course, I was busy. I didn't have time for studies. Somehow I ended up at NED, right? In NED, I was in the swimming team, basketball team, volleyball team, and the field hockey team. So for 4 years, I didn't have time. And then in the final year, I ran for the office. I was a class representative of 1984 graduation class, final year, man. So, I mean, I was a sports person. I don't know how I ended up with education. I have no idea. Uh, when I was in the States, the reason I'm saying this, after this much education, people think once you have graduated, you are done. Actually, not. No, that's not true. Even today, I spend 20% of my time, free time, in educating myself. If I don't spend 20% of my time educating myself, I will be left behind. And that's what I'm afraid of. So, people are chasing right now dollars or money. How am I going to make money? My message to them is go seek knowledge. Once you have the knowledge, money, fame, fortune will follow you. You don't have to chase money. You just gain knowledge. Once you gain knowledge, people around you respect you. They look up to you. When people come to you, you solve problems, and you get the rest of the things behind it automatically. हमारे यहाँ जो प्रॉब्लम है, nobody is seeking knowledge. वो जुगाड़ करके they want to make some money today. They don't want.
And that also, they want to make money overnight. They want to be rich overnight.
Right, right, right,
I mean, the worst, I mean, adding fuel to the fire. I mean, although they are taking the wrong track, but the double wrong track.
right, right, right. So I think just pursuing knowledge, and अब जो आजकल का ज़माना है वो ये भी है कि you know 50 things, but you are not the best of those in the world. If you're not, you will have a hard time surviving. We all have to seek perfection. Nowadays, अभी क्या होता है कि आपने कोई मशीन बनाई, 100 मशीनें बनाई, उसमें से 95 सही चल रही हैं, 5 खराब हो गई. Nobody will talk about 95. Everybody will talk about 5. So the world, you and I have zero tolerance for mistakes. आप एक शर्ट खरीद के लाते हैं, उसका एक बटन टूटा होता है, उसके 25,000 स्टिचेस हैं, उसकी आपको फिक्र नहीं होती. यू कॉन्स्टेंटली टॉक अबाउट वो एक बटन टूटा हुआ है. So this is the world of perfection, and we have not grasped it yet. Okay, this is the time we have to be perfect. We cannot slack it. And I mean, I'm sorry, I'm going to say this. The whole country is crazy about cricket. And we are not the best in the world in cricket. That tells you the psyche of the nation. I think we got to shift this thing. We got to go. We have a lot to learn. We have a lot to learn as a nation. We have long ways to go.
So, sir, have you been to, sir, have you been to any of the campuses of Rihan schools?
I'm sorry, have I been to what?
Rihan schools, any of the campuses of Rihan school?
I have been scheduled to visit. It has not happened yet. I am actually waiting to formalize the time. उनका time हमारा time जो है अभी sync up नहीं हुआ. I am anxiously waiting to go visit. And I was also waiting for Rehan Saab to come back from Houston. Once he's back, then I will definitely visit with him. It may not be a bad idea to have a joint podcast with him and then have a discussion.
Yeah, sure. True. Because I mean, today I'm really super excited. I mean, listening about your AI context and your device. You are developing devices that they are so simple that lay lady can, a lady without prior education can handle this. This is amazing, and this is where Rehan Foundation comes in. And since even the kids, so I really, if you got some time on Monday, that's tomorrow, and you are in Islamabad or in Karachi or elsewhere.
I'm in Karachi.
You are in Karachi. So what if you can visit Korangi campus maybe tomorrow or day after tomorrow, whatever time you have, I can really schedule your if you like.
Yeah, definitely. I have actually जो कोरंगी के आपकी वो instructor हैं उनको I have given my office admin's number, and I think they're trying to coordinate a time. They're already working on it.
That, I really request you, sir, because this will really you and Sarihan, you are of similar mindset people, and there's just you can write some formal MOU or whatever, and he can get you interns. And I have got since I am also teaching under trainee AI teacher with their institute. I mean, I'll be completing in 3 days, and I have got a friend with me in my class. He is a Form D doctor, and he is technologist, but he is a very poor champ from Khairpur, Sindh. So if you allow me, I can get him. And this is Moin. His name is Moin Technology Wala. So he probably and he's the stuff what you want really. He's got the intellect too. He's got the pharmaceutical background, pharmacy background, and he is very dedicated hard worker. I mean, I mean, if you can take him aboard, or if you like each other, I suppose. So he's a kind of breakthrough person, but he needs bit training, because you coming from USA can train him so well. Over here, he's got the passion, the knowledge, everything. But we need some formalization. I myself, I also need lot many things. I mean, though I am hard driven person, so I keep connecting people, keep asking, requesting people. So I keep talking, and I have built such a. If you see my library of videos, this is amazing. I mean, you will find and every type and kind of person. So and he's another gem of a person. I would really recommend that I'll ask him. He'll interview you, and you interview. I mean, this will be a podcast. So if I think he's the one. I mean, maybe you can take him as an intern or apprentice initially. Then you can employ him if you want. He's a teacher. He's a primary school teacher in Khairpur, Sindh, and he is so underprivileged, and he is underutilized, I would say. And then you are the one, you can bring him best, I mean, for this. And
Sure.
sir, anything, any message to the planet, sir?
No, no, actually, this is great. I think you guys are doing great work. Let's work together. उसने कहा था अरस्तु ने कि excellence is a habit. I have the audacity to say Arastu was wrong. Excellence is not a habit. Excellence is a process. It's a system. And people, those who become good, excellent at anything, I guarantee you they excel at everything they do in life. Because they know in order to excel at anything, there are 3 C's. You have to concentrate, you have to commit, and you have to collaborate. When you're doing something, you have to be 120% there when you're doing it. You have to concentrate. You have to commit. When you're doing it, you have to do it 40 minutes every dang day for 5 years. Same thing, repetitive. Just keep doing it, right? You cannot learn and become excellent in isolation. You have to collaborate. You have to find mentors, you have to find teachers, you have to find friends who help you, seek their knowledge, and together it becomes something big. So as a nation, I am preaching and pushing everybody to commit themselves to become excellent at anything they do. And when you do it, feel proud that this is what I did. Look what I did. Right now, when I ask my team to do something, and they come back and say, "वो आपने कहा था मैंने कर दिया." He did not say that, कि देखो, look what I did, what a wonderful job I have done. And I think that's what we lack as a nation. We need to transform and become excellent whatever we do, and we should feel proud that this is what I did.
That's amazing. It's an amazing
Happy note.
advice. And you please complete. So please complete.
With this, I think with this happy note, I think we have covered it a lot. And thank you very much for the time. I really appreciate it. We have a couple of action items. Let's follow up, and then we go from there.
Thank you so much, sir. I really cannot thank you for your time, and especially the heart you have for not only for Pakistan but entire globe. And such a sweetheart you are. So thank you so much, sir.